I'd like to start off today with a little survey. Please raise your hand if you are satisfied with the engagement or experience you've had with your health system, hospital, or health plan. Ooh, not a lot of hands. All right, how about this? Raise your hand if you are excited about the materials that your hospital system has sent you. Emails, texts, correspondence, anything? Anything? One hand. All right. So why is this important? Why are we talking about it today? Today we're going to talk about patient engagement and what we can do to improve the overall engagement. And that's important because we know an engaged patient is a healthier patient. But we're really starting off at a disadvantage because communications today hit about 99 out of 100 people as completely irrelevant. It's only about 1% of the information and the communications and the conversations and the emails and the texts that we have with people actually work. So all of that work our organizations are doing to communicate are not being relevant to the patients we serve. And so I'm going to talk a little bit today about how we can help change that. So I did a little survey at first to figure out how I could understand what the industry is really thinking, because we know today's patient is different. This digital consumer, this medical consumer, has choices, and they're starting to make those choices. So I talked to hundreds of executives at healthcare organizations, hospitals, health plans, PBMs, and I asked them, would your patients switch organizations with you as a result of poor communications and engagement? And about 33% said yes, which I thought was kind of surprisingly low with as much as I know about what's going on in the industry. Even more concerning is that health systems and hospitals, only 21% believed that patients would switch. And I guess traditionally that makes sense, right? Because we always used to do exactly what the doctor ordered, right? We would follow along and we would do what we thought they wanted us to do. But today's consumer is not the same. They are being educated by Amazon and other organizations who are providing these digital experiences. So it's easy to buy an airline ticket. Super easy to buy something and get it delivered in 30 minutes with the drone, right? You can do that in any other industry but healthcare. What other industry could you be in where in 30 days you will get a bill that is a complete surprise? Would you buy a car that way or your house? Absolutely not. But in healthcare, that is what we do. We do not communicate and we are not transparent. So I said, well, okay, now I know what the industry's thinking. What does the patient, him or herself, think? 78% of patients today would switch hospitals and doctors as a result of a poor engagement or experience overall. So this is a significant problem. And if we understand that engaging your patients is the way to deliver and create better health overall for our individuals and communities, we have to make a change. But we know it's hard, right? Navigating our healthcare system here in the US and even across the world is actually quite difficult. And what we found out is 33% of patients actually have no idea what to do. And another 19% consider themselves novices in the process. And why is that important? It's important because they wander through the system without guidance, which creates an incredible amount of excess cost. They have multiple appointments, they get lost, they don't know where to go, they don't know how to collect their information, they don't know how to deliver a good outcome for themselves, they don't know how to advocate for themselves. And this cost, this is at $3.4 billion, is just administrative costs. This does not include the cost of the excess medical or inappropriate medical care that's done as a result of patients not knowing how to navigate through our system, and the unbelievable amount of stress that we as a system create on these people who are already sick. We know the more stress you add to the person who's sick, the actual sicker they become. And it's not just the stress, it's the cost. Patients avoid getting treatment today. Your loved ones avoid getting treatment because they don't know how much it's going to cost. And more than 1 in 8 people believe that by avoiding getting care, they're actually worse as a result of it. So they put off the care that could help them be healthier, and because of that, they actually become more sick. And we continue this cycle over and over. And the third piece of this stool that gets overlooked is the social determinants of health. For a long time, we thought, well, where you live, and if you're in a food desert, you can't get access to food, you don't have transportation, just was affecting the individuals who were poorer than we were. But we have found that even people with significant incomes today are affected by one or another social determinant. So their economy, where they live, their ability to get access to the things that they need. We are not treating the whole patient. And because we're not treating the whole patient, we're actually making them sicker. And we're not providing them the capability to advocate for their own health. So for an example of this, we had a patient who presents in the ER a couple times a month, heart condition, can't figure out what's wrong with him, keeps coming in, he's miserable, he's so unhappy, it's costing the system a lot of money, but the worst thing is we can't seem to figure out what's wrong with them. The health plan goes out and visits him in his home in August in Texas. It's 115 degrees in his apartment. He is suffering from heat exhaustion. So for $200, they installed an air conditioner and they never saw him again, right? So they had to look at that entire individual. And as a community, right, we can do that together. But as a single individual treating just the patient in the ER, we can't understand his circumstance or her circumstance. We have to treat the whole patient. It's become very, very important. And it's not easy, but it is a trend that we are starting to see changing how we engage with our patients. And I know it's hard, but if this was easy, all of us in this room would have already solved this problem, right? It's not easy, and it becomes more and more difficult to engage your patient because everybody is trying to do the same thing. We're all throwing tons of information and communications and emails and texts at people, and we're not doing it in a sophisticated way, and we're not doing it in a way that you see other industries doing it. And as a result of that, we are actually creating numbness to the institution. However, the demand for what we need to do in healthcare continues to grow significantly. Patients are going online now searching for information, and we are not providing the best solutions for them. We need to start imagining and emulating what's going on in other industries because patients are out there searching, and they're just at the tip of the iceberg. If you think about how many people are digitally enabled right now, it's a small percentage compared to the populations that fall from behind, or following behind them. And so we want to be able to drive a much better experience for these people. In order to do that, we really need to think differently because today's healthcare consumer is not the same as even 5 years ago, as even 2 years ago. They're impatient, they're educated, they search everywhere, and they want instant gratification. And we are not able yet to provide that capability. Partly because our organizations are large, they're siloed, they're managing hundreds of different programs, and they're not personalizing and communicating in an engaging way. Every department, every silo is sending different information out there. Nobody's talking to each other, even within our own organizations. We're just dumping what we have, and we're just sending it out across. And we're creating a really painful experience for our consumer. So we're pushing information. We're saying, this group of people all look the same. We're going to just take all that data and send it to them. And we say, oh, it's a bummer, I got a 1% response rate. I think I'll change the subject line. Let me try that again. And we keep going around and around in the same process. But we're doing such large groups, it's so impersonal, we don't have the ability to connect with these people when we need to. And when you create a personalized program, you actually can affect change. So we had a patient who was pregnant, she was in a high-risk condition, she had a heart condition, we were coordinating 9 different specialists. At the moment she was going to deliver, they were going to provide open heart surgery for her. If we couldn't personalize our interactions and communicate instantaneously together, right, we couldn't guarantee the health of that mom and patient, right, in the baby. You really have to focus on how we can do it differently. We're training people to ignore us, right, with all this information that we're throwing at them. So what can we do differently? To start, let's look at the patient's point of view. If we have a human-centric or a patient-centric view, and we look at every step along that patient's journey, and we understand what they need in context, in their moment of need, we have the ability to streamline the communications that we have, streamline the outreaches, and actually provide information that's useful to people. We have to make it more proactive and transparent. We cannot wait for it to just be a glob of information we send. So if you know that your patient is in Florida as a snowbird every January, why do we keep sending their medications to their house? Like, why do we create this stress for people? We have the technology to do that. Amazon can do it in 30 minutes. We should be able to do the same thing. Can we personalize the information? Can we target it for that individual at their moment of need? And if we do that, they're going to start to listen to us differently, and we're going to be able to improve their overall health. But this only works if we follow that patient journey and we stop looking at the information that the organization wants to push out, and instead we look at what is the information that that patient needs at their moment of need. So some suggestions on how we might do that. You want to start off very contextual. You want the information to be in context at that person's moment of need. You want it to be very specific and very personal. It would be ideal if it was also consistent. If you're on the website, if you're on a mobile device, if you're getting a letter, wouldn't it it be ideal if all of that information and all of those flows were the same? Can we make it easy for people? We've traditionally made it really, really hard. But if you go to other industries and you look at what they're doing, they have the ability to make it really easy. They also make it contiguous. If you're on an airline site and you're putting in a trip to China, the next day you come back, it asks you, are you still going to China? When you go to a healthcare site, they say, what are your medications? And the next day you walk over, what are your medications? The next minute you walk over, and you literally do the same list 10 times. I know this, I've done it with my dad, and even I can't remember after the 10th time what the medications are that he is taking. And when someone is sick and they're down and they're tired, it's even harder to be able to remember and have that contiguous experience. But with the technology that's available today, we can deliver the solution for our patients. Let's make it easy for them. And if we make it easier for them, we'll actually even make it easier for our businesses. So I have a couple of ideas on how we can do this. Let's be more efficient. Let's gather the information right the first time. Keep it accurate, keep it simple. Make it seamless. If we make it easy for your patients, we make it easy for your employees will be much happier, will work much more collaboratively with your patients. Let's make it easier for your clinicians and your providers. How about making it real time? If a patient just gets a significant diagnosis, they don't want to know about our health plan's system of record and how they can get points for being healthier. They want you to empathize with them. They want you to understand who they are. They want you to know them. Make it proactive. Don't make them chase down the information. We know what we need to do and what they need to know before they go to a medical visit or before they go and have surgery. Why do we wait till they show up to share with them what they need to know? Why can we not provide that information to them ahead of time to make it easier? And if you think of nothing else from what I'm saying today, if we can think about making it personal, how do we deliver the right information to the right person at the right time? How do we make it specific? If I'm a diabetic marathon runner, I don't want you to ask me and suggest to me that I need to exercise. I may be a diabetic, but I'm pretty healthy. And I know this because one of my colleagues gets that same letter in the mail every month from her health plan. They do not know her. We need to make it personal. One way to help us do that is actually to use artificial intelligence to take and get rid of the clutter. Use AI to break down the silos between businesses and functions and even departments within your own organizations. Use it to streamline the information. Use it to deliver it to the different channels, mobile, web, even email. Use it to be able to communicate in a way that's much more efficient, much more effective. And it can do all the hard work for you so that the people on your teams don't need to. If we do all these things for our consumers, for our patients, we will create a better overall experience. But we can take the same techniques and apply that to our clinician experiences and to our employees. We have to make the whole system easier for everyone. We can apply the same capabilities across the board. And now if we actually take that patient and bring them to the center and bring them part of the equation, we have this pyramid of equal patient, clinicians, systems, administrators. We bring everyone to the table. We empower everyone to make better decisions. And at the end of the day, we will create a much better engagement process. And so why is it important? Because we actually asked the patients, is engagement important to you? What would better engagement do to help you with your health? And 65% of them agreed if we engaged with them in a better way, if we actually could embrace them and deliver the right information at the right time, they would take better ownership of their health. And when you take better ownership of your health, you actually become healthier. If we can create one healthier individual, we can start to create healthier communities and create an overall healthier population. I truly believe that together we can improve patient engagement and deliver better outcomes. And why wouldn't we? Because nothing is more personal than health. Thank you.